This gentleman had his upper 6 veneers done in Miami several years ago, came to my office for the main reason that he wants to add veneers in the rest of his mouth. Typically, I don't add to existing veneers because for whatever reason, if it's the color, the shape, or whatever. In this case, I kind of said, you know what? I'm not going to put you through the hassle of redoing those. I can add additional veneers. So I'm going to show you what it looks like, the preparations, how the veneers look on the model, and then the final outcome. So we started with this smile, and you can see he had the front 6, so he wants everything else that you see in the smile. So that's why this kind of photo is so important. So you can see these are the front, these are the top 2 that we did, and then as well the bottom 10. Every tooth that he shows is what he asked for veneered. I understand that because the front 6 teeth are white and the rest are yellow. And the reason that I allowed for this case to not have to redo the front 6 is because I actually thought the aesthetics was pretty good. There's nice translucency, the color is what he wanted it to be. It's a masculine kind of front teeth. The canines are a little bit bulbous, but it's all good. However, when I'll show you later, these aren't really a veneer prep. This is the other doctor's version of a veneer prep, not my version of a veneer prep. You'll see exactly how my preparations look. So when we retract the lips and we look at everything else, those are all the teeth that he would like veneered, and that's exactly what we're able to do for him. So this is the original, and then this is the preparations. So the interesting thing about the preparations is you can see there's a lot of different colors in the teeth. And so we're going to capture all of that information. In order to have a uniform ceramic, you need to know what the underlying tooth truly looks like. So in this case, you can see this is how the preparation is completed, where most of the tooth is still intact. He had a little bit of decay here and here, space, a gap here, and so, and decay here. So we incorporated the veneers to eliminate and get rid of the decay, and then as well to seat over the smile. And these are the upper preparations. You can see really not much needs to be reshaped. You can see where the margin is, and then basically this is it for the ceramist to finish the porcelain on. Here's my veneer. Here is what the other doctor told the patient that he did veneers. In my opinion, these are full coverage crowns because there's only about 5 millimeters of natural tooth showing on the back side. So when a doctor says veneers, you know, that's unfortunately, that's what that doctor thinks that are veneers. So we now have to take photos of the existing porcelain so we know which the shade that we're going to, and we need to take shades of the preparations. So these teeth are this shade. Then these teeth are the same shade. And lastly, these bottom ones are a different shade. So you can see that color is different. So these two are two very different. This is a 2M3 and this one was a 2M2. And that's why it's so important to take photos. I have about, I don't know, I would say 150 photos per patient. Yes, 150 photos per patient because I do the steps the same way every single time. These are the bottom veneers as well, just from the back side, overlaying where it was. That was some decay. There was a gap here. So now you're able to see these are the top veneers that are kind of flowing with the existing smile that he already has. And that's how minimal you need to make the veneers on the top. This is now the final version. That's the original veneer. This is my veneer. Those are all my veneers. So you can see how we blended and we're able to take the existing veneers and create new veneers to match that color, even though we use a different ceramist. Same thing on this side, and then from the front, there we go. The translucency is matching, the body of the tooth is matching, and obviously now we have the harmony of the smile as well. So now he got exactly what he was looking for a smile that all the veneers look the same.